$110, and then an increased county appropriation. Our total was $741,901 is what we're asking for, an increase for this year. So looking at a glance at past fiscal years, you can see that we haven't changed too much from going from 17 to 20. In 2017, it was a little over 10 million. We moved up to a little over 12 million, but then again, that is due to the 70-some thousand added for the payroll accrual. And then you can see that as far as the FTEs, we've not increased that much. The FTEs for 19 and 20, that was a big jump from 2017, but it does include our grant staff in there. So that concludes our presentation for our ask. Do you have any questions?
In the past, we'll start over here, Melvin, if you have questions or comments, and go around.
On your infant, thank you for the presentation, a very good presentation. On the infant mortality rate among the African American, what are you doing proactively to deal with some of that? Are you visiting? I noticed you visit some churches, and I think that's one of the key areas. Are you still doing that, and how effective has that been?
Yes, sir, it has been very effective. We have a infant mortality group called PIMPAC. It's the Pitt Infant Mortality Prevention Advisory Council, PIMPAC. Has about 100 members. We're the oldest advisory council in the state of North Carolina. We've been going strong for well over 30 years, and we do have some members of the faith community on that council. We still do presentations to churches, we go out into various civic groups. We have numerous grants that are including the Healthy Beginnings program that address infant mortality, that are outreach programs in the community. We have a Healthy Start program that does the same thing, where we actually locate women in the community that need services and get them plugged into those services. And it's multi-layered. Even the home visitation program is part of that. Most of the time when women have their baby in the hospital, they have all the support they need there in the hospital, but it's when they go home they don't always have that support or know where to go to for resources. That's why it's so important for us to get in the home, and we are doing that. We just need to be able to do more of it. Yes, we also have our centering program, which is a program where we do group prenatal, where women can come in and get prenatal care within a group, and it in turn turns into a support group. That's another thing that we do. It's multifaceted. Over the last 30-some years, we've added so many programs, and that's why we don't want to lose anything. We just want to make sure that we continue to lower that rate.
Thank you. And I think I like this report. It gives the actual number, and it then gives the percentages, because percentages can be skewed. So I really like that part, that we get to see the actual numbers. Don't have page numbers, but I'm referring to your vital record slide.
Right.
That was the first one that jumped out at me. And when you said that approximately 2,000 of the births was Pitt County residents, babies.
Right.
And my question came, I wonder why we have 13,000 deaths.
1,300.
Yes, I made it wrong. I'm sorry. 1,300 deaths of Pitt County residents when we're a progressive county, and that was a bit surprising.
Right.
But even though I know
It is, yes, it is. And heart disease, stroke, cancer, those are our leading causes. Old age, right.
Well, I've been
Stress.
Budget workshop.
There's some things, and there's been people in my district who people found dead for a number of those reasons. But what get me was, I tell them, I say, plant a cabbage and a collard, and your health will be better and you can live longer. But I want you to know that this one right here that goes into the statistics, and the 1,300 was the births. I'm curious as to the attributing factors. That's a curiosity. But I like
For
the report.
infant death, you're asking what's contributing factors to that, or death overall?
No, it was the babies.
Now that number is
I'm past 50.
okay. The contributing factors to infant death, prematurity is the leading cause.
Oh, okay.
Babies that are born, most of these babies never make it home from the hospital. They're born extremely premature. And prematurity meaning anything before 37 weeks of a person's pregnancy. And that is the leading cause. Birth defects, sudden infant death syndrome. We don't have too much of that in Pitt County anymore because of our Back to Sleep campaign, but it's usually prematurity. But lifestyle of mom is a huge factor. So overall health is paramount, making sure that women are healthy, called preconception health.
With the vote and the veto of the governor the last time, there has been a lot of phone calls relating to that vote and the veto and that sort of thing.
Now those deaths, that would not be included in this count.
They
These are
wouldn't be
babies.
included.
These are babies that are born alive, have a birth certificate, and they're planning to go home from the hospital with mom, but it doesn't happen.
And these are births that are born alive.
They
I
are
think
born alive.
That they would talk. Not.
Oh, okay.
I'm talking about that vote.
Right.
And I'm trying to equate that with the health situation, and I'll talk to you more privately
Okay.
about it because I need some personal knowledge as
Okay.
to
Be glad
what,
to.
and people, we do need to understand that because it's a very important vote for us.
Be glad to talk to you.
Thanks, Amy, for coming. Thank you both. Couple of questions. One, you mentioned on the full-time nursing positions that some of those services would be billable.
Right.
So you do expect some additional revenues to come back to the county. Would the current debate in Raleigh right now on Medicaid, would that affect potential funding for those services that are being rendered and monies that would potentially come back for the county for those billable services?
Medicaid expansion?
Yes, specifically here.
I would assume it would increase our Medicaid base, Medicaid revenue.
Okay.
Would it cost the county additional money as well I think DSS has alluded that it would cost the county, as she will when she comes forward, Medicaid expansion, but on the health side, health department, would our bottom line increase with the general fund appropriation to health because of expansion?
I'm reading that Medicaid expansion will increase our revenue. We may have to add more positions for the 6,000 that I think in the
Right.
county that Medicaid expansion will
Right.
benefit from. But,
Right.
but none of the white papers are showing much of the detail of that Medicaid expansion that I've seen anywhere.
Of course, that will be more women that will be eligible for these home visitation services.
But those services would be billable and potentially
Right.
we would receive the revenues back. Okay. Thanks. Now, the second is just on the dental assistant. Have you all had discussions with the School of Dentistry about, and I guess currently are there plans to have dental assistants to come in
Find a
and
dentist, I was like, take the bus.
fill the need just for clinical hours and training? Is there a potential there to not hire those positions but to fill them through the School of Dentistry?
There is no plan to fill that position through the dental school. The dental school has, from what I've been told by the dental school, they have a lot of community dentists already
Right.
filling their need in
Right.
the clinic. They're
Okay.
using adjunct teaching. The dental school had no desire to help us with the dental bills. We reached out to them. We had numerous meetings. Dr. Morrow had numerous meetings. We thought it could be a very reciprocal. They could put a junior faculty member. It would fit their mission as far as rural health. We were hoping to lease the bus to them. I threw out all kinds of options, thought that they would take it. They happened to come.
So the answer is not yet.
Correct. The Bernstein Clinic came to our rescue.
Okay.
They enjoyed that model because you have a built-in no-show rate.
Right.
We go to 17 schools in Pitt County. The bus is getting some age on it, but Dr. Vincent is enthusiastic. She is seeing kids. The problem is these kids have never seen a dentist.
Sure.
And it is scary. It's scary for me at 43 to go to a dentist. because I know it's going to cost me, and I don't know what's going to happen. But for a 5-6-year-old that's never seen a dentist, that may not even have their speech because they don't have their teeth. So it's a very needed service.
And actually, this summer, we are moving the unit to the health department for the, I don't know if it's the first time, it's the first time we've done that with having a dentist on site. So we feel like we'll be able to serve even more children because, most people know where the health department is.
Oh no, when we couldn't find a dentist, it was very scary and very stressful because I knew people needed dental work.
Looking for funds to do that.
We do have Smith Family Partnership really wants to come on board. Plus is 22 years old. We use HIS, which is the Health Information System, which will be going away. That's why we want the Epic, which will need a new. We're talking with Biden about using Dentrix, and Dentrix is the global dental software that interfaces with Epic. So I mentioned to Mr. Scott that will be something on the horizon. But yeah, we're very excited to see children being seen with us.
Thank you both for the presentation. I'm really relieved to hear that our infant mortality is still, especially among African Americans, is still high. Mm-hmm. I thought it had gone down.
It has. If you go back and look at this 30-year tracking, it has gone down, but it's just not gone down as fast as we like to. And I'll tell you something else that started to happen. There used to be a huge disparity between the white and the non-white rate. And it still is, but the white rate's going up a little bit. So that's not how we like to narrow the disparity. But the white rate is starting to go back down a little bit, looking at 5-year averages between 13 to 17, those last few years. And the African American rate did go down. And that's why we're so afraid for any program that we get rid of that we know is a support program, and that we're going to take a ding again. So,
and I'm thinking that mothers not being able to have care before birth because of not having insurance or Medicaid coverage. How much do you think that plays into health care before birth?
well, preconception health is huge because, the healthier you are before you conceive, the healthier your pregnancy is going to be. So, and right on down to your lifestyle. We have had huge preconception campaigns over the years where we would go into businesses and work with women, and not just women, men too, because both men and women need to be healthy to make sure that they were improving their lifestyle behaviors. And that's what public health is all about, prevention. So
I just think we just have to be aware of the total picture when we're looking at all facets of our community, whether it's economic, or whatever. Bringing businesses into our community, those businesses are going to look at the health of our community.
That's
so,
exactly right.
It's not just one piece out there by itself; it's all of it together. And so, the healthier our communities is, the better. So, I just think that if we can find a way to offer programs that will produce healthy outcomes, then that's gonna be good for all of Pitt County.
Right. Thank you.
So it just, I'm just so bothered by when I hear cuts, that impact health care,
Well, that's why we were bothered with when the grant was not funded for the Healthy Beginnings program, because the high-risk women in that program have done very well, and without being part of that program, they probably would not have. And that's about 40 women per year that program serves, and it follows the babies for 2 years postpartum, 2 years after delivery. and plugs the children into resources as well, making sure they're getting health care.
Yes, sir.
Thank you so much.
Thank you.
As usual, you all do a remarkable job.
Thank
And
you.
I mean that, thank you, with what you get.
Thank you.
Thank you. Yes.
I guess for the new board members, just to, in terms of grant-funded positions, the board's policy in the past has been when grant funds are received and we hire people, whether full-time or part-time, if the monies go away, then technically the positions go away, unless you as a board make a decision to fill the gap. In this case, you'd have to fill the gap for these infant mortality positions that were referenced. I did not recommend them to be filled based upon your policy, but knowing we'd come back before you and ultimately you'd make that decision. This is part of that 45, 46 positions overall that were requested in the budget. As was explained with the budget message, for the most part, what this budget does is continue the existing array of services with the different components. And we talked about the increases in retirement, health insurance, and so forth, as well as just in continuing those, showing that 3-cent tax increase. I can look at additional positions, but then I got to find the revenue, or I've got to find other programmatic areas to cut to accommodate the inclusion of positions that you may want to include. Or, I'm not advocating, and I wouldn't recommend looking at more than a 3-cent ad valorem tax rate increase within the general fund. I mean, that's a lot just in and of itself. So that's one of that statement.
It's not just 3 cents. There are three districts are asking for a fire tax. And in the one I live in, they're asking for 2.75 cents. So you add 3 cents, 2.75. Now we're talking about almost 6%. 6 cents there. So some people are going to get hit potentially disproportionately hard. The other thing with the Department of Health, typically they have a lot of positions that are not filled, and yet they're budgeted. So by authorizing them these new positions, are they not offset by the fact that none of the other positions are 100% manned all through the 12 months?
Well, go back to last year at budget time. Commissioner Colson, you argued, and we put into place a policy with public health with their nurses and like positions that we would not make them subject to the 30-day freeze that normally all positions are subject to, other than public safety, i.e. the sheriff's office, communications, EMS, and so forth. But remember, though, that 30-day freeze creates lapse salary that when we plug the budget with fund balance of $3.5 or $4 million, or $4 million in this instance, if I don't have that fallback at the end of the day, or at the end of the year, come June 30th, we're going to be spending that fund balance. I know you don't like to hear that, but in order to philosophically to plug with fund balance, now we could say let's just stop that practice. Don't plug with fund balance. Well, we could stop that practice, but it's that $4 million is equivalent of 3 pennies on a tax rate. Every penny is $1.3 million. That'd be 3.9. So it's just shy of $4 million. But then we could say, okay, anytime a position becomes vacant, somebody leaves or is terminated, we can immediately hire it and fill it. Then for the most part, we could then just not have to worry about a fallback, or the fund balance plug falling back into the general fund, into savings.
Well, what about the fact that several of the things that Amy brought up are almost 100% self-paying for? Those positions are not the same as any other position. Not all positions are equal. Would you agree to that? Some pay for themselves and some are expenses.
Yeah, we looked at those two, and she pointed out that 2 of them would eventually become revenue producing at $120 per visit, but it may not be this year, it may be the 2021 budget. So this year's budget would have to take a hit until they could develop, I guess, the caseload and so forth for those to cover expenses. So that was kind of, if they covered expenses this year, I would have said, fine, that revenue expense matched, go forth. But again, use the board could override that.
No other comments?
We have a break on the agenda. Do you want to take a short break?
What time is it? 10 till
It's
10?
10 to 10, and we're behind. What's your feelings?
Eating the whole time.
Oh, okay. Anybody need a different kind of break? Okay, okay. We will move forward then, Jan, with you, and I think, where are you? There you are. And do we have Andrew?
Schmidt.
Is he? Well, I was wondering if we might want to.
What time is it supposed to be? 10:50. She's probably going to take,
I'll take about an hour.
yeah.
Just know, it's gonna take about an hour, because you're gonna have questions,
I'm gonna do a
and
2-minute
we're
Yeah,
doing
let's
some.
break. 2-minute break.
break, and our next presentation is from Jan Elliott of Social Services.
Good morning, everybody. I put a sign up that kind of gives you the idea of kind of how I feel these days. It's a crazy time at the DSS, and thought we might be good to have a little humor in this, serious discussion, because I know it is a serious discussion this year. There's a lot of good stuff going on that is potentially at risk because of the funding issues. I want to recognize our Board of Social Services. We have two of our members in the back, Mr. Jim Cox, who is our Vice Chair, and Dr. Sheila Bunch, who is a board member, and obviously Ms. Perkins Williams is one of our board members, so we have three present today as part of this discussion, and certainly wanted to recognize them. And the second thing I want to do, which is probably not good for me, but I want to support Amy's budget. Those nurses, those home visits, those kinds of things are one of the prevention issues we have for child welfare. And going into those homes early can prevent that shaken baby. It could prevent that co-sleeping, those kinds of things that result in us get a call in child welfare. So I hesitate to do that because it may impact my own budget, but it's going to impact my budget either way. If you cut those positions out, I'm afraid we're going to see more child protective services and more potential children coming into foster care because those other children that are in the home might have to come into care. The other issue that I would say too is we work with them very closely. Here I go. We work very closely with them with their CC4C program because of the drug-affected infants. We are getting 8 to 10 drug-affected infants coming into referral process with us each month, and we get involved, but also the health department gets involved to make sure that those children are getting what they need. So all of that's really important. So now I've been told I need to talk fast. So I do want to thank you for your past support of this department. It has been very important to us. We are a growing county, and this department certainly feels the effects of that. We are no longer the welfare department that you all know and love. We offer opportunities for people to improve their lives. We are about the safety net for supporting the working poor. We are about strengthening families, protection of our most vulnerable, job training, child support, so many other things we do with the Department of Social Services that are not what people automatically think of about us. We know that strengthening families makes our community stronger. And that's what we want to focus on. This budget is about safety for our children and adults who have diminished capacity. It's about reducing trauma, particularly for the children, because it can have a lifelong impact on their success in the world. We're about improved decision-making for the department. We're about timely service delivery. It's about reducing liability to the county and hopefully reducing staff turnover because of all the stress that folks are feeling. I know this budget is a huge ask, and I know the county has some really hard decisions to make, and I certainly want to acknowledge that. A lot of the things that we're asking for this year are things that we've been asking for in years past and have not been funded, so they continue to be high issues for us. We have to serve every day, whether we have adequate resources or not. We are required to produce and to meet all of the mandates that are out there, and we're held to standards that assume we have adequate staffing to do the job. So my job clearly is to make you aware of the needs that we have. Your job obviously is to try to figure out what you can afford to fund. And so there may be, consequences down the road, and that certainly we all know and understand because you have to make these hard decisions. This budget does not reflect anything that might be happening in the legislature. There is talk of some money to help with our adult services programs, although very limited. There's talk about additional costs coming that might be impacting the county that haven't been plugged into this budget yet, such as a personal care increase allowance for the folks in the special assistance, the rest home kind of population, which they desperately need. So we don't know what all those things are. We're just trying to juggle it right now. So our critical program impacts that we want to talk about first, again, for those of, several of you have not been part of the agency or the commissioners before, we have a variety of things that drive our budgets, and these are just some of the things that are coming down the pike right now. These are the things that cause me to feel like this. We've got Medicaid transformation, which Amy's already alluded to. Will be effective next February. We expect that to impact about 70 to 75% of our Medicaid population as they move into that managed care system. They will start getting notices in September to try and figure out what they need to do and how they need to sign up and all those kinds of things. It will mean changes for social services. It'll mean changes for the transportation department, for the county, for health, and for the LME. It's a huge change that will mean more work for the department, at least during the transition, because we've got to help all of our clients who call and say, I don't understand this, I need help with this, all those kinds of things. We've got to explain it to people. We have got to make sure that all of the addresses are in the systems correctly because of all the mailings they're going to get, so that they can choose their provider as opposed to being assigned by the state. So we're beginning to get our staff ready, and there will be more client education in the near future. And it's really a whole new language, PHPs, PMPs, PCPs. It's just a huge, huge change. Medicaid accountability is on this. Last budget, 2017 budget, the legislature passed a law in the budget that requires that the county pay back any Medicaid errors that are found. And these are errors that are found during an audit of some sort, be it a federal audit, the single county audit, or a state audit of our programs. And it is, so if a case was open for 6 months and they were ineligible at the time we determined that eligibility, any Medicaid costs that client incurred during that period of time would be the county's responsibility to pay 100% of that back to the state.
Nursing home or
Well, for a nursing home, that's several $1,000s a month plus whatever their medical costs might be. If somebody had a kidney transplant, you all can just guess or figure out what those costs might be. Insurance is being discussed and explored in a variety of counties. That's $85,000 roughly for a county of our size, with a $10,000 deductible for each error case that is found. And I hesitate to knock wood, but Pitt County thus far has avoided this for the last few years, but several counties have had these chargebacks. It would be difficult for Pitt County to repay $100,000. It would be devastating for Hyde County to pay $100,000. So we're working really hard to try and get the legislature to change that. The legislator who introduced that bill and who has passed that bill is not willing to move. He is not willing to budge, and he is a powerful person in the legislature, so most folks are not willing to step on him and make those changes themselves.
right now we have not sought out or tried to get insurance coverage that you alluded to, but it is being discussed among counties, and it's
Right.
a possible option.
Right, and some counties have done that. Again, you're still on the, going to be paying that $10,000 on each case, no matter what. So we're liable for the paybacks. There are also in this law timeliness provisions, takeover provisions of the department, and a variety of other kinds of things. So this law drives us greatly in a lot of what we do. The Hawkins case that's referenced here has just been passed down by the federal court. We've paid attention greatly around the areas of applications. That's what all the prior court cases has been. This court case says you've got to do the review timely. If you don't do the review timely, that person could lose their eligibility for Medicaid while you're trying to process that review. So what the state's remedy for that, and what they agreed to, was that we would automatically extend month to month the person's eligibility until that review is done. Obviously, if that person was not eligible, that opens us up to, again, the potential for the claim. And I will say the state auditor got all of the audit reports from last year and extrapolated that the counties were in error 21.9% of the time, I believe was the number off the top of my head. I'm sorry, 21.9%, $21.9 million, let me get that right, out of a $7 billion Medicaid payment. So it's a very minor amount, but it by county is really
I
crazy.
think when you calculate the percentage on it, it was
That's 0.004%.
at the time.
So counties are doing a good job, but that one case can be significant. Well, when we're also found wrong, if we don't approve the person and they were eligible, we have to pay for any any medical costs they would have incurred. So now, child welfare, we have going on, the state's modified manual is being implemented. That is going live on May the 15th. We've been working on that for a year or two now. This is going to require a lot more staff to assure safety, more supervisors to assure safety. May result ultimately in our caseload standards being downsized from right now. We have a maximum of 10 cases in CPS per worker. By standard, we exceed that. A maximum of 15 in foster care by standard. So this could drop it below those figures, which would make us even more out of compliance. NC Fast is coming, and I just don't know what to say about that. Those of y'all who have been around for a pretty good while know NC Fast is NC Slow. It's currently been delayed in child welfare, and we are anticipating Pitt perhaps rolling into this now in January. There are 2 bills in the legislature to try and slow this down even further, to try and get some better outcomes. This system is not the system you need in child welfare, but is the system the state has purchased and spent $90 million thus far that they would have to pay back. 50% of that would be federal money if they do not implement. So I understand the legislature's concerns here too. We've been in pilot mode in some of the counties for over 18 months. But we have loss of productivity. What they're seeing is at least a 25% loss of productivity, and that's borne out with what we saw in food stamps and Medicaid and those other programs. The potential safety issues for children and the data is not particularly reliable at this point. Raise the age, I know Mr. Elliott mentioned that as it relates to detention. We don't know how that's going to impact us with foster care. We do get some children from the juvenile courts that are in trouble with the law now. But we don't typically get from them the 16 to 18 because they've been in adult court. There is certainly the potential that those kids could start moving into our system in certain situations. And these would be folks who don't belong at YDC, the youth development, programs, but they can't remain in their family for some reason. So that's why we sometimes get those children. They are a problem certainly to find placement for. Most foster parents are not excited to get a 14-year-old in their home who's been stealing or whatever, and I don't know that they'll be exciting to see a 16-year-old in their home who has similar kinds of problems. But we don't know. The Families First legislation is a federal law. It's supposed to go into effect in October. It is going, and North Carolina is not going to jump in October. There is some potential for pushing this out. There are some pieces we might have to start doing shortly, but North Carolina is trying to move as the law allows to push this down the road a little bit. What I will say is that one impact is going to be moving the services, the dollars from foster care to the front end to prevention. So the goal is to reduce the number of children in foster care so you can shift those dollars to help with prevention. There are no new federal dollars attached here. One of the down things, however, is that they will not allow us to use group homes for more than 2 weeks for placement for any of our children. And we use group homes and homes like Baptist Children's Home, those kinds of folks right often. So for our teens especially, and for our family groups, when you've got 4 or 5 siblings you need to keep together. So that's something that we've got in, that's one of those balls that's up in the air that we're all trying to pay attention to and trying to plan for. Many of you knew about House Bill 630, which was the big discussion in last year's legislative session. Its enactment put several things on counties. One is the Memorandum of Understanding. I think all of y'all have been here for at least one minimal discussion. No. We have one person who has not been here for the discussion about Memorandum of Understanding. The Memorandum of Understanding lays out certain performance measures for us and actions that they can take if you do not meet these performance measures. It has gone through several iterations for a variety of reasons, which I won't spend time on. The MOU is between the county and the Department of Health and Human Services in Raleigh. the ultimate penalty, and there's a whole lot of possible options you go through before you get to the ultimate penalty. But the ultimate penalty is that the state can come in and run your program if you are not meeting the requirements, and the county cost would be borne, obviously, by the county. The state would not pick up any of those additional costs until you've improved sufficiently to run your own program. They've done that once thus far in the last year with the county in the West. The Social Services Work Group is also out of this same legislation. It started out and everybody got upset because what they were going to do was to have regional social services departments as opposed to county social services departments. They were going to reduce the number of social services departments down to 30 for the state. There were lots and lots of issues, and obviously the mental health reform jumped out in everybody's mind. Lots of issues, won't talk about that. It ultimately, based on a lot of work that we did and the Commissioners Association did, morphed into a regional supervision by the state for counties. It didn't change the counties, it changed the state administration, which we believe is going to be wonderful, but they're going to put, and a plan's there, it's going to roll out over the next couple of years. But we do think it's got some real positives from that standpoint. There were other things that came from that social services work group that may be impacting the counties. It's all got to work through the legislative process, so you'll be hearing more, but we're paying attention to all that. The work group is going to continue to meet. There's a bill to extend its life. The Center for Support of Families, there was a budget a piece put in this whole House Bill 630 that said that the state had to put out a contract to have a full study of the social services program, how we work in North Carolina. And so Center for Support of Families has gotten that grant, that bid award, and they are looking at a variety of strategies. They're doing a major study. They are beginning to put out some of their information now. There's a report due to the legislature, probably was the end of April or early this month, about some of the things that they're looking at. Most of their suggestions are going to cost money and are going to need a lot more development before they can be implemented. One of the first things that I think they probably will be able to go forward with is training for social services board members as a mandated activity, and they're suggesting 2 times per year. They're trying to look at, like I say, a lot of other things, so there's a lot of wait and see going on. So now let's get to the actual budget, because those are some of the factors that are flying around out here. Our budget is about $1/3 billion. And if you look at that dollar figure, our budget increases about 1.7%. Obviously, the county dollars have increased more than 1.7%, but that's looking at the overall budget. You can see that, wait a minute, you've gone too fast. I ain't there yet. No, I ain't there yet. See, the clicker thing. Okay, so, let me have my clicker. Okay. Well, there's supposed to be a picture.
So it's not here yet.
I don't know why you don't have that picture. It's a picture that looks like this. Okay. Well, their numbers and my numbers aren't in the same order. So let's go to the next one, then we'll back up. Let's keep going. Here we go. Where's my budget? There you go. Let's get to that one first, and then we'll back up. See? Okay, that's what we get for running around like crazy. So this is the budget, and this is the budget that about $33 million of it flows actually through the county general fund, and about $12.4 million projected for this year would be the county share of all of that. So if you look at the total monies that we're involved with, we're about 3.7% coming from the county. Again, that's supposed to make you feel better. Don't know that it works, but it's supposed to make you feel better. The funds that we generate based on the work that we do here in Pitt County have a significant impact on the Pitt County economy. You know, we pay out over $10 million, or right around $10 million to daycare centers. If we weren't paying those funds, those daycare centers might be struggling significantly and some might close. We pay out over $46 million through food stamps to the grocery stores in this community. Over $240 million is paid out to medical providers based on the work that we do determining Medicaid. So those are huge impacts on the economy of Pitt County. Our child support program generates nearly $15.5 million in child support payments for the children in Pitt County. And so we believe that we are a large economic impact on the county. So wanted to make sure that we had that discussion and that you did see what percentage was the county. All right, now let's see if I can go back. Okay. So, looking at the drivers of this budget, 12.4 million is the county. We've got in here spaces for office increases for our needs for guardianship, adult protective services, foster care, and I know, hold your breath, 24 positions, which is an 8% increase. About 15% of our increase, as has been mentioned by everybody, is coming from the growth in the employee mandated expenses, such as retirement, health care, et cetera. That's about $500,000. Our foster care payment growth accounts for about 19%, and foster care is one of those things that you've got to pay. You've got no choice in it. And it's around $800,000, and that is actually, we are overspending this year, and so this actually will cover us for next year, we believe. So a total of 31% is found just in these two items of our budget increase. Some of this is tied up in the additional space request, and Mr. Elliott did comment already that he has worked something out with Trillium to provide us some space using one of those group homes for staff. So you know, obviously that will be cut out of the budget. It hasn't been cut out of this, but obviously that will be cut out of the budget. It buys us a little bit of time. We have left it in this discussion just because it needs to be on your radar. The staff request, it certainly is the biggest ask. Many of these are positions we've asked for before. So failure to be adequately staffed does a variety of things. It increases stress and turnover, but more importantly, it increases risk to the children and the adults that we serve, and to the county when a child dies or an adult dies or is severely injured as a result of us not being out there timely or doing what we needed to do. And then there's obviously the Medicaid error, which is a liability for you. Our foster care caseloads have increased dramatically, and we pay out over $243 a month for foster care. Many things cause that number to be so high, but one cause was when we had lack of staff. Our foster care caseloads were growing, and children were coming into care faster than we could accommodate that. And so that meant that we couldn't work with the families and the children as well as we needed to in order to move them out the door much more quickly. So there's a cause and effect that is seen when you aren't adequately staffed. And we want to congratulate you and thank you for giving us the 4 staff last year, because I've got some numbers that are going to show you that's paying off. I will give that back to you. Let's get through here. Okay. In a lot of our conversations with the manager, there's been some question about, well, you know, how do we do with comparison counties? Why is Pitt County struggling? Why are we having all these needs, et cetera? So we went out and looked at our comparison counties, and I used 8 of them. I think that's the correct group. There could be a couple more, I don't know. But we went out and looked at those. And so we are trying to benchmark some against those, and so I pulled up some data just to kind of help you get a sense of why we look different, and I'll try and run through this real fast with you. So first and foremost, and many of you have heard this and probably are tired of hearing this, but Pitt County is the state's only metropolitan county affected by both persistent general poverty and persistent child poverty, the only one. And persistent poverty is defined as having more than 20% poverty over 30 years or more. Most recent data shows us at 21.7% with general poverty and 29.6% in child poverty. That was 2017 data. In 1960, we were sitting at around 60% poverty. So we have made huge increases in growth, progress in that time period. And you heard Lee Guth talk the other day about the fact that 23% of Pitt County is food insecure. So that certainly, is some of the driver. And just to further down, we are one of only 48 counties in the country that have been labeled this way, metropolitan counties. So Pitt County's poverty certainly affects families and children. You can look at the childhood poverty in comparison counties. We are 2 percentage points above the North Carolina poverty rate using a 5-year average, and you see our comparison counties are all below that figure. This opioid certainly is compounding some of our problems, and so if you look at the opioid crisis, we certainly are a high risk there, and that has an impact on the work with families. 5 of our comparison counties are also in those red marks. Family disruption, dissolution, whatever's going on with families contributes to child abuse, child neglect, and other issues for families, and that then ultimately leads to the increase in the number of foster children in Pitt County. You can see that we had a 105% increase in the number of children in foster care. None of our comparison counties have had that level of increase. Some of that growth occurred when we were having staffing problems. The vacancies meant we couldn't work as quickly with the families or locate other resources so that child could leave care. We are not meeting the 12 months to permanence goals as set by the state and federal government. You see that rise started in 1617, which is when we had our vacancies starting to show up, and then also so we were having to juggle cases then, and then you add to that the fact that resulted in more children staying in care longer, plus we had more coming in the door. So last budget year, you approved the staff we needed, and so they are now trained, and we're beginning to see that payoff, and the vacancies are beginning to get filled. Looking at the first 4 months of this year, 34 children left care. We had 22 come into care, but 34 left care. And last year, we had, in those same 4 months, 13 children to leave care. So you can see that having the caseload smaller, we're able to do better work with children and families. We had 27 children come into care in 2018, so we're reducing on the other end too. It's going to take a while to reverse that trend of more children in care, but we are definitely making progress with the fact that we have better staffing at this point. The rate of increase in foster care has only been seen, this percentage, in Durham and Pender County as far as metropolitan counties. They're the only two that have seen more than 100% increase. And I struggle with Pender being a metropolitan county, but they're considered metropolitan because they're in the New Hanover group there, which would pull them into the metropolitan determination. Vulnerable adults. The abuse of our vulnerable adults has increased by more than twice the average rate of Pitt's comparison counties. The silver tsunami is upon us, and so this is going to continue to grow, not get better. And I'm just going to use one number. By 2036, 104% increase from today until then for the 75 to 84 age group. The numbers of children and younger folk are going to be slowly decreasing, not hugely, but slowly decreasing during that same time period. 40.3% of our seniors will have at least one disability, and 11.1% will be below the poverty level. So this, again, is an indicator that we are at the very tip of this now. The numbers we serve that are age and disabled are only going to rise. Abuse, neglect, exploitation is on the rise. And why? Why are we getting more reports? Part of it is we've done a better job in educating the public about what this is. But part of it is, we're much more mobile today. Self-neglect is a big thing. When your children are living 4 states over and grandma's here or mama's here, they don't always know and aren't able to follow up as much, and so you're seeing some of that reflected here. You're seeing, obviously, the mental health concerns, the substance abuse issues in the exploitation and in some of those kinds of things. But those are just some of the drivers. If we look at our guardianships, they have increased by 70%. Half of that growth occurred between October and January, and we've had a 106% increase in our guardianship caseload since 2015. Guardianship is somewhat driven by our APS caseload, mental health concerns, and the inability of families to manage extreme behaviors when there are significant mental health behaviors. Vidant here also has some impact on that because folks wind up in the hospital. They don't have anybody who can make medical decisions for them. They're not maybe able to make the medical decisions for themselves. And so we find ourselves being appointed or being asked to seek guardianship on some folks at Vidant. Vidant is very helpful with this. They do help support some of our staffing costs. So the increase that you see here where we spiked should have been more gradual. But we spiked because we had vacancies in the APS area, so we didn't have enough staff to be out there working it timely, and so things backed up. Once we got back to full staff, we started looking at those cases and started moving them, and so it all happened kind of at one time. We are the only agency that can serve as public guardian in the state. And I would like to note also that the state puts absolutely no state dollars in APS or guardianship. They only do federal. They only move federal monies around. So this is totally a federal and county cost. All right, our Medicaid growth, if you look at the other counties, our Medicaid growth has outpaced every county except Onslow. Medicaid is a reflection of our poverty rate. Additionally, the hospital does help us with this. They do fund some positions so that we can get applications processed, because that's going to mean that they're going to get paid if we can get that Medicaid for them. So they pay the non-federal share for at least 5 positions, and the School of Medicine pays the non-federal share for 2 Medicaid positions. This gets folks in the door processed faster. It does not. They do not pay for that review that's due 6 months to 12 months down the road. So we are getting some support there. Our food and nutrition cases remain fairly steady. You see, we had a drop, and then we started going back up, and it's a minimal growth. We're going to be interested to see how this goes. As long as unemployment remains low and folks are working, we should continue to see that drop again. But you see that Pitt, and the only other county that had an increase was Onslow, and we are pretty certain that had to do with the hurricane and the fact that lots of folks got put on food stamps at that point through the disaster and have remained on food stamps because they found out they could qualify. So, critical space needs. I'm just going to hit this just to say we need space. We're continuing to look. We have got to ultimately address this issue. And the best plan would be, obviously, to reconfigure the Human Services Center and perhaps add to that Human Services Center. It's in your capital budget, but it's in your capital budget sometime out. We currently are in 2 buildings. We deal with a lot of confidential information, yet we have 2 and 3 staff in some offices, which is not good. None of the buildings that we're in were designed for the kind of work we do. We have wasted space in there, but you can't reconfigure. And I don't need to be out there trying to reconfigure and spending money on reconfiguring when a year or 2 down the road y'all might be able to help us out. So we've put up walls, we bought freestanding partitions, but I'm not going to do that anymore because I feel like it's just wasting money. We get about 48% through the depreciation as reimbursement through the depreciation schedule. And if you want to see more about this, we have talking points in your package, and so page 1 has that. And this was just some of our options that we were generating as we begin to talk about this. Moving right along to the adult services and foster care. The first 3 items on this list do get some federal reimbursement, so don't believe this is all county money. We're doing a variety of things to move children out of foster care in Pitt County, but we've got to find better ways to address safety to hopefully reduce the number of children coming into care. If I can stop them coming in the front door, then we have done a great thing. So we believe that the investment in science and safety will help us with that. This is an initial down payment. We've applied for grants to do this with. We haven't heard on any of that. We have got to do something to start this. This will help our staff. We feel like we could pay for additional installments on this if we don't get any grant monies. By the savings in foster care cost could be shifted in this direction to continue to fund this. We believe that, let me back up. This is a really promising practice. It's used internationally, and it's one that Wilson County has probably been involved with, I believe, about 7 years. They only have about 35 children in foster care last time I heard. Now, granted, that county is smaller, but that is a significant difference in the way those numbers are playing out. We also have a work group going on in the county that is working on developing a prevention plan for Pitt County. So we're trying to approach it at the front end, and this budget would help us with some of that. We've talked about foster care payments. I'm not going to belabor that anymore. We do provide foster care for our 18 to 21-year-old population if they sign an agreement with us, and that's for children, young people, they're not children anymore, young people who are going to college or who are starting their first job, those kinds of things. And you and I do that for our own children. We give them a little bit of money to help with that car payment or that first apartment or those school books or whatever that they need when they can't get it from somewhere else. So we do this. We have a very successful program. We average about 16 to 18 young adults monthly that we're working with on this, and this is driving the cost up because we do have a very successful program with large numbers of children. And again, the payoff in the long run is going to be great if these folks can get this education that they need and get started on the right foot. And the last thing is our unmet needs for adult clients, and there is no reimbursement. This is all county money. This is for our APS and wards. When we need to keep people safe and they lack the financial resources, it puts us in a situation, since we have responsibility for them at that point, to obligate funds from the county to help them be safe. Generally, it's a short-term commitment of funds. It would happen perhaps when they've applied for the financial assistance, but the facility won't take them without some initial upfront money. So this tides them over till that gets approved. It might be somebody who's over the income limits for certain programs, and they might need a medication that they don't qualify for Medicaid. Our mean that they need some additional services that they can't get from somewhere else. So it's a safety issue, and we are, for our wards, we assume some pretty big responsibility just because they're our wards. So if you want to look at this further, we've got some talking points in your package that's on pages 2 and 3. The folks that I'm guardian for. These are the folks that the court appoints me to be guardian. I've got about 160 or so on any given day. They come to me from Cherry Hospital. They come to me from all over the place. But a lot of them come from our APS caseload, our Adult Protective Services caseload, because we find that folks are not competent to make those decisions for themselves as we do that Adult Protective Service evaluation. It sometimes comes to us from family members who are arguing over who needs to do what, and the clerk of court decides that we might be the best person to manage that family's or that client's needs. So we get into this in a variety of ways. I believe I have someone who could not stand trial for murder because he could not meet the competency levels. We have someone with some other charges that are pretty significant, and they couldn't meet the competency levels. And so Cherry Hospital has given them to us, and they will ultimately be discharged from Cherry. So you know, we have a significant number of those folks. It is. It's a big number, and it has grown by leaps and bounds. And more of them are having mental health issues. And it's not grandma who's 80 years old, who has dementia and is sitting in the nursing home and needs somebody to make decisions for. We're talking, we have folks from the point they turn 18, and we will have them unless they can get reestablished and don't need a guardian any longer. We could have them till they die. And so we're making decisions for guardians that we've never had to make, decisions about family planning, decisions about, marriage, decisions about, because folks have rights. Those don't go away. We have to make decisions as we go along. The bulk of our decisions are around medical issues, life decisions, but we can have some interesting discussions on any given day. And we're finding with our younger folks, we're coming into conflict with the fact that frequently we're taking children that they have, which gets us in conflict legally because I've got custody of the children and I'm also responsible for the parent. And so those cases have to be negotiated with other counties to reduce that conflict. So a lot going on there. Won't speak. Well, kind of. We'll keep going. Kind of, yeah. There used to be 3 of us, but now there's only 1 of us left. Okay, so the positions. We're going to start with our economic support services staff. And I want to say that the manager did approve 2 IMC2s in his recommendation. Income maintenance caseworker 2 positions. And these are the folks who do those Medicaid reviews, who look at reports, who do those applications. That's what this group does. hopefully to lessen our liability, because right now our folks carry about 1,200 cases apiece, which is huge. So let's talk about what's happened. That lovely bill back there that gave us the payback piece also gave us a whole lot more reports that we need to work and were being generated, because they want to make sure that folks who get Medicaid are eligible for Medicaid. And so there's a lot more electronic availability of information. So we're working 20 or more reports on any given day. We have one report that has a 5-day turnaround that we have to address. Working those reports are critical, and in fact, working those reports have been helpful. We've identified over 300 referrals to our program integrity section because of overpayments, and some of them could have been inadvertent, but because of overpayments. The staff have to then verify all the information that's on these reports, and because we've got these reports, we're held liable for not reacting to these reports. So. The cost to the county for this, personnel cost only, would be about $12,000 per position. And that would be for all of the income maintenance 2 positions. We're asking for the supervisor in program integrity, because program integrity is growing because of all these reports in part, but also because program integrity has gone into NC Fast. Program integrity needs a lot more support, oversight. There are clear expectations in the memorandum of understanding around program integrity. So having a full-time supervisor as opposed to the program manager who supervises about 14 or 15 different people with different responsibilities, having that full-time position would certainly help us improve our quality, maintain our statistics, do better tracking, enhance the number of prosecutions that we do. This is 4 programs that would be involved in this. The program manager, as I said, I've already mentioned that. The cost for this position is $20,000 in county money. The IMC2s, this is to handle that Medicaid growth that we noted earlier. This is the review section. And the Cohen case, the Hawkins case is an impact. We are working a lot of overtime just trying to get these cases reviewed on a timely basis. Staff are worn out. There's also, we have to hold folks accountable for 97% quality. Again, we're being held accountable at 100% by the state, but 97% by the federal government. So folks are going to make mistakes, people, but we're holding them at a 97% quality, and that's a pretty big quality standard. They have to process things timely. There's no option, no way to do otherwise. So we are estimating, again, that we need 4 positions for this spread across our Medicaid review section. 2 income maintenance caseworker 3s to supplement our trainer, the trainer focuses primarily on new staff coming in the door and major policy changes that everybody needs to get trained on. You have folks who come in, and Medicaid is a hard program. There are 22, 23 different pots you can reach into, and you have to determine eligibility for each of those pots before you can determine ineligibility. So folks sometimes struggle with all the policy. And so having somebody one-on-one who could work with folks might help us reduce our turnover, and it also might help us improve or at least continue with our good error rate at this point. And that's about $14,000 per position. And then with Medicaid transformation coming, we know we're going to have significant numbers of phone calls, people coming in. We need folks here who can spend time with our they're going to be called beneficiaries now instead of clients, with our beneficiaries. And so if we can do that in our customer care section, as opposed to having them have to go talk to an income maintenance caseworker who's busy processing cases, we could in fact save us some time. So we're asking for that position. That would be about $11,750 in county money, and the talking points there would be on pages 4 and 5 of that document if you want to look at that. So now moving into child welfare. We are asking for 6 new positions. One is to split our child welfare section into 2 sections. One is and add a program manager position for foster care. Again, you've seen that foster care is significant. The county cost here would be about 40%, and I'll get into that. Foster care is now called permanency planning. It's no longer the foster care unit, it's the permanency planning unit. But anyway, We have the new integrated manual and other requirements being imposed that are making this really, across the board, too complex for one person to try and manage all of those programs. We have 3 distinct areas we work in. The current position supervises 10 social supervisors, 2 clerks, a data evaluator, a licensed clinical social worker, and also helps cover our interns. And like the health department, we need interns. So the foster care area, or the permanency planning area, licenses homes, trains foster parents, does adoptions, does the 18 to 21 program, handles placements, works with parents to reduce issues so they can go home, all of those kinds of things. And so we've got indicators in the MOU, we've got federal indicators we have to meet, but the most important thing is we need to do the best we can for our children. That's the critical piece, is helping children succeed and get where they need to be. So if we can split this out, it would allow the current manager to focus on child protective services, and the new position would focus on the foster care program, and they would have to work jointly together. And you need to remember that child protective services is a biggie, because if we make a mistake there, you have a potential death or severe injury, which again, bad for child, but increases liability for the county. The county cost for this would be about $32,000 for personnel. We're asking for an interpreter, and you know, if I have to rank positions, this would be one of my big ones. We have only 2 interpreters for the entire agency. Those 2 interpreters are trying to serve all 280-some folks that we have on staff as they have the need. We are seeing more and more work with our families and child protective services who are Hispanic and need an interpreter. This past year, we served 103 Hispanic families in child welfare. Because of the confidential nature, it has to be a county employee, needs to be a county employee when you're talking about child welfare issues. And this is not a one and done, go out one time, meet with the family, and we're done. This is like you're going to be working with this family over 3, 6, 9 months or a year. So there are many visits this interpreter is going to have to go on. This means on-call work. It means work out in the field. This past year, we have spent a lot of time doing that, and we have had to increase our overtime for these folks. Whenever one interpreter is out, this leaves one person at the Human Services Center to handle the walk-in traffic. That's not really doable. But then, even worse, if one of our interpreters is out sick, and one had a vacation schedule, then we've got nobody. So we truly do need this additional position. We need someone assigned full-time to the county office building who could back up the folks at the Human Services Center. County cost for this would be about $12,000. The social worker 3 for foster care in here is to help us offset the reduction in timeliness, the loss of productivity, which is being projected. And if we really staffed with that 25% loss of productivity, we'd be talking about 10 or 12 staff. I'm just trying to get us a little extra help here for that loss of productivity to kind of help soften that. That's about a $32,500 county cost. We need an investigation, assessment, and treatment person, which is our CPS side of the house, and that again is because of the NC FAST piece, so I won't spend much time on that. The county cost would be $24,150. And again, these are the personnel costs. The manager did approve a staff development position to focus on the NC FAST training and troubleshooting, so we thank you for that. We saw that it would be critical during implementation. We saw that in the other programs as they implemented, especially food stamps and Medicaid, having someone who could do that kind of thing, and we didn't have that initially, and I think that's part of what drove some of the problems Pitt County had. The folks that we have doing this currently at the Human Services Center already are trying to support 200 people, thereabouts. I don't know that they could add this additional group of about 50 to 60 people. And in addition, they need to be able to understand the law and policy as it relates to child welfare and how that integrates with the system. And so this really does need to be a new position, and the cost would be about $21,000 for this. Social worker 2 to help facilitate the foster care transition. As children come into foster care, we need to have meetings with families, with the foster parents. We need to determine things like the eligibility sides of whether they qualify for which programs, because we have different funding streams for foster care, all of that kind of piece. We have one social worker now doing this. She's carrying a full caseload in addition to trying to do this. We need to speed this process up. And so we are projecting this position would cost us $21,000 in county money, potentially could save us money if we can do our determinations faster, because we might could use a higher rate of reimbursement quicker for the foster care portion of it. Adult services, and this is a critical area for us. The growth is dynamic here. There were no recommendations in this area, and potentially because, as you see, there's not much money. It's 50% reimbursed. In APS, we may get a report that the person's being neglected and find folks living in filth with severe hygiene issues. We have had folks with bed sores where you can see the bone. We have had elderly dementia patients who are living alone or being left alone by their family. There are those that exploit and convert funds to their own use. Some of our folks need placement to be safe. Sometimes we can put services in place to support the family. We get into freezing bank accounts, for example, or taking other actions. We saw 20% growth just last year in the APS referrals. We've had 4 staff in 2012. Today we have 5 staff. And that's because we transitioned someone from another position to help cover this without adding additional staff. The maximum caseload size should be 15, and on any given day, our staff could have far more than that in various stages of the process. Dropping the ball in this area can be significant if you don't do what you need to do in an APS case, because again, you're dealing with very fragile individuals who could have potential problems that could result in death or severe injury. Yes, for social worker. So we're way excess of that on any given day. Okay. And when we are short-staffed, it was even worse. Our guardianship, we had the supervisors were doing APS during that period of time. We were in such bad shape. Our guardianship caseload, as you've seen, is going through the roof. That should be a 1-to-25 or 1-to-30 ratio, and these ratios are your maximum that you should be carrying. 25 would be for those that have mental health issues. 30 would be the older folk who don't need as much support. We have 4 staff trying to manage this in the agency. One of my staff came to me Tuesday, and this was interesting that it happened on Tuesday, to talk about a case. He has a 19-year-old with some behavior problems who is in a group home. This young man has gotten a job, and we want to support him moving forward and being as successful as he can be. But there are a lot of moving parts. And the worker was wanting to do all the right things and was trying to talk to me to talk through this to try and figure out how to make this happen. But he's got over 40 cases that need intensive service. They are mental health cases, this young man being one of those. And so he can't provide the level of services he feels this child needs, this young man needs. And so he was frustrated as he was coming to me trying to process and figure out how to help this young man and look at how we could reach out to support this young man. A guardianship position and our APS positions would cost you about $32,000 in county money from a county cost for personnel. So I say, though we've got to do something here, we've not helped these folks in years increase the level of staff support. And remember, these folks also operate your special needs shelter during the hurricanes. Our social worker 2 that we're asking for would provide in-home services to individuals who need a little extra support, but maybe don't quite rise to the level of guardianship or a higher level of service. And if we could put some folks there, it might allow us to do more with less. That position would be about $21,000. We're also asking for a supervisor just to come into compliance with the 1-to-5 ratio, and that would cost $38,500. Now, we're also asking for new staff in child support and legal services. The child support agent was approved by the manager, so I want to, again, thank him for that. Because this really allows us to focus on better collections for our foster care children, which could reduce the county's cost ultimately. If they get caught up in the other caseloads, we're finding, because our caseloads are so large, they tend to fall to the bottom of the group to be worked. And so having this will be very helpful and could ultimately save the county money. The cost here is $13,500, so it was a low-cost position. We're getting desperate for an attorney in child welfare, just desperate. Between child welfare and APS, or adult services work. We are at the point we really need 2 full-time CPS attorneys and 1 full-time APS attorney, or adult services attorney. I call it APS, but it also does guardianship. With over 200 children in care with many legal deadlines, plus they consult and file on CPS cases. We have petitions, adjudication hearings, dispositional hearings, mandatory reviews, permanency planning hearings. Failure to be timely can impact our funding because it's tied to us moving cases through the court service in a court system in a timely manner. But more importantly, again, it impacts a child. We have filed, if we file a termination of parental rights, a TPR, and we win, there is now an automatic appeal to the state Supreme Court. That has not been in place before, an automatic appeal. We have filed 20 TPRs since June. Those have not all gone through the system. Most of them have been worked prior to this law change. I signed one yesterday. So TPRs are going to, and that you want to move children into permanent placements. And so if it's terminating the parents' rights, then that is what we need to be doing. So there's going to be a huge cost potentially with that. We spent $24,000 in appeals work last year, and that was only probably 4 or 5 cases in a variety of different areas, not just child welfare. And we contract that out because we don't have the staff to do the appeals work ourselves. We had 2 cases last year that took us 10 days in trial, and that tied up 2 attorneys during that process. And that is not common, but it is not out of the realm of possibility. We just had an adult case petition that took us 3 days in trial. The standard workload, according to the Bar Association and according to the state, should be 60 in child welfare. With over 200 children in care, just that piece of it, we are certainly far exceeding that caseload standard. We wanted the second attorney to handle the appeals so that we would not be contracting out appeals anymore and any overflow that occurred in our systems. The cost for this would be about $46,000 in county money. And if we don't do this, then we're going to have to need to add some money back into our contract line item to cover this additional appeals cost we're going to be seeing. The paralegal for child support can help us increase our collections greatly in child support. This is a fast-moving operation and a large operation. We have 3.5 paralegals for the entire agency. One of those is in child welfare and adult services, but she does back up the child support folks. The paralegals can improve collections by getting more motions filed, referrals done, all of that kind of legwork for the attorneys. In the first 4 months of this year, we had got 3,547 cases under order. We could increase that with that. We had, in the most recent year, we established 1,828 cases in the establishment area. There's a lot more that paralegals do, but clearly we are, when our attorney talks, she says it's like a production line. They are just moving all the time, and they could do so much more with a little more help. And that increased collections means more money for parents, but it also means increased incentives because every dollar we collect, there is some incentive to come back to the county if we meet our responsibilities and our goals in child support. The actual match cost is $14,400 for this position. So, did I make it in less than an hour? Yeah, I think I did. Anyway. I didn't fall off the wall. Y'all need to know I'm standing on a law book back here so you can see me. So that ball actually was out there. I'm kind of balancing. So anyway, questions?
Total.
I have 283.5 positions.
Okay, how many of them are, how many positions do you have that are not filled?
Today we have 12. We average anywhere from 12 to, it runs somewhere between 12 and 20 on any given day.
But those 12 are allotted.
They're budgeted.
Yeah, they're in the budget.
They're in the budget. They
Okay.
are,
Are you subject to the 30-day freeze?
The manager has done a little bit to help us there, and it's based on some of the conversations we've all had over the last couple of years. Our freeze, as I understand it at this point, is the county portion is what we're being frozen for, so that county percentage gets returned of that salary and fringe. I can't remember if I'm getting the 30 days or not.
We're trying to, but the case is dire, but CPS, Child Protective Services, APS, Adult Protective Services, if you make the case.
I have to make the case, and I do frequently make the case. Sometimes I win, sometimes I
And
don't.
if they're grant funded positions, there's no freeze. If it's grant funded, it's 100% money.
But I
they
don't
go
have
out.
100% positions, generally.
If you,
Yeah, yeah.
Is that 23.5 you want, or was it 24? No.
24, I realize, I'm asking for what I need. I realize that is not what I will get, but yes, sir.
Okay, I don't have any further questions.
Okay. Cindy?
Yes, Commissioner Colson asked my question, and I guess what I would like is to just ask maybe the county managers to, or maybe your department to provide an HR breakdown about where these positions are currently. 24 is a big ask, and what I'd like to see is that we're in-house doing everything we can to be the most productive before we're going to fund that many additional positions, just to make sure that we're doing the housekeeping thing. So.
Mrs. Elliott, as the board member representing social service, I want to first say to you and your entire staff, having been with the board and going to all these meetings, to say that you are to be commended. I want you to know that. But at the same time, I would like for the board to know that even though the state law came into effect by this senator who is no longer driving, and I'm not calling names, I screw up y'all's name, so I'm not gonna call any names. We had a meeting, and the county, we went to these meetings that was provided, I have, with the NCAA, North Carolina Association of County Commissioners, and the meetings for DSS one, so all of us know about the North Carolina Association, and the one with the DSS. And in the one that I went with DSS, I'm just sharing some information, the training that we had, and we met with the bill maker of the one that's changing the entire landscape or culture, am I right, Ms. of DSS. We have fought not to have the Senate. I supported that in a very strong way. But also at that meeting, that senator not senator, whatever she was, that legislator who provided that, got that bill through, could not answer the questions. All the commissioners was in this room that day as a separate little side for DSS, couldn't answer the question, what data she used to make all these changes. It was a personal why. And the commissioners was upset because the counties are having to fund the things that they set down. So it was a rather radical meeting. And to find out that there is no data, am I right, or has it been done?
The data, and that's part of why the MOU is still being dealt with in a variety of different ways. The data is still not reliable data in a lot of areas. And so, yes, you're
And so this is why the board, the commissioners won that fight to support DSS by not having these super centers. And because they could not answer how the county residents were going to fare either. But with all the meetings in NCAA, North Carolina Association of County Commissioners, and DSS, there is so much unknown about these changes. It's like going to school in kindergarten with no basis, and they don't even know what the mama is making them leave home and sending them out there in the world with a bunch of unknowns. So it is a highly concern that we take, and I don't envy all of this, but it's already passed, and she's got to address it. Now, as far as all the positions, I don't know what to say about how they meet it, but this staff is really to be commended, you all, because they are really working hand over fist to meet the citizen needs. And I appreciate Mrs. Elliott's comment about health services needs. I don't know how we're going to do everything we need to do. My education was not in social service. My education was in information progress. So I don't know how she's going to do it, and I don't know, y'all been on the board as long as I have. And Mr. Elliott has been very supportive for this. So I want you to say that and I don't think any of it is unnecessary, but they can't answer the question when you ask the question that relates to funds and social services. They have no answers. Even the social service who was there and whatever. So the commissioner got up and walked down sort of like a protest or something. But it didn't solve the issue that she has to face it. So all I wanted to say was to say thank you. That's all I wanted to say. And I attended all of the meetings, all of the regional meetings that you all appointed me to. And I've educated myself beyond the fact that they don't even know who made the law to answer the questions. And I just want you to know that. They can't answer the questions. She can ask the question, and they can't answer her questions. And the bugs, the worms, the bullfrogs, and the goats will not get answered to some of her questions that she must face, or we're going to pay the price. That's the point I want you to know. And when I said paying the price, them jokers got to find the money. Thank y'all. Thank y'all. Thank you. Y'all thought I was going to say something, didn't you? Thank you.
Didn't you? I must have missed something.
Thank you.
Mr. McGlone.
Thank you. Thank you for the presentation. The NC FASE, and you mentioned it earlier, that has been a tremendous challenge throughout my being a commissioner. I thought that problem was solved.
That's a big joke.
Now, let me ask you, what seems to be the difficulty in dealing with that? Because I understand, if I can remember correctly, there was we got this NC FASE from some other state, and they were doing pretty good, as I understand. So explain that to me, and then what are we doing to deal with that? Your organization, your statewide organization, what are they doing to?
We've written letters. But let me start first. This is a Quorum project, a product which is from IBM. It was decided upon probably 10, 12 years ago. They began doing the work that needed to be done on it. There may be one state that's using this. I think Canada. There are a couple of folks. A couple of places that it's been used, and I understand at least one of the places that has been using this has sued because it is not doing what it needs to do. I think that's in Ottawa maybe or somewhere. It was probably for the state who was using a green screen system that was built in the 70s. This looked slick and good, okay? And so they started some years back putting it together. Well, technology has moved now way far beyond where that is. So that's one of the problems. I can't tell you why we have, for child welfare, there's over 300 sheets that you have to job aids that you have to look at to figure out how to operate the system. We have similar kinds of situations in our economic services. The last couple of days I've been seeing red screens come up that says, we apologize for the slowness of the operation of our system. And that's in our food stamp and Medicaid area where folks are trying to push cases in, and it's taken a long time to get anything in because the other day I called about a client to find out some information, and I got the worker to pull it up in the food stamp system. And we sat there and had a long conversation before it finally came up, because it was one of those days it was operating slowly. We are still doing system workarounds, and we have to save every piece of paper that says tells us what system workaround we're doing, when we were doing it, and what the exception that we're doing, that they're making us do in order to make it the system process. Because when we get audited, we're not necessarily following the rules that exist, so we have to be able to produce the fact that this was the rule in place when we did this. We are getting extra things we have to work, because the system is, because it's a system that goes across the entire agency and then across the entire state. If I change the address in one place, it goes across over here, and which is a good thing. But at the same time, sometimes those addresses don't match up at the end, and we had people's food stamp benefits that didn't go out because the address got changed. And then the counties have to step back and readdress every one of these and put something in. And there were probably 5,000 cases across the state that got impacted by this. I mean, it's a constant work to fix what this system does. Why, I don't know. That's above my pay grade to understand that, but I know there are issues. I do know that the Social Services Working Group that Ms. Perkins-Williams was talking about, one of the recommendations that came out of there as it relates to child welfare and adult services, and perhaps a bigger area, was to say we really need to re-examine the use of this system. And in fact, there are 2 bills in the legislature as we speak to slow that process down for child welfare. We were supposed to go live in September. They've now pushed it probably to January. But it's not even up 24/7. And if you're in child welfare, you've got to have access to a system 24 hours a day, 7 days a week. They have to shut the system down at about 8 o'clock at night to do the batch processes that have to be run in order to get benefits generated and all those changes done. So from 8 o'clock until 5 o'clock in the morning, you don't have access to this system. So that's one of the things that we as an association have said, until you can fix some of these things, we're not bringing anybody else in here. We're through. We're done. And so the legislature's heard us, and that's why we're having this study done now, or this slowdown now, so that they can in fact study this. We believe that for child welfare, this is not the system. It is not a system. It's a click, click, click kind of system. It is, you can't use it out in the field. Well, child welfare is out in the field. So, I mean, it's a mess. Now, I will say in economic services, it has improved. I used to have 50, 60, 70 help desk tickets a day. We don't have that many, but when we have one now, it's a bad one, because we had one recently that the person didn't get their benefits for 4 months because of that help desk ticket.
Have you discovered what type of economic impact this is having on social services? I mean, you know, it sounds to me that this is a...
Well, you know, again, we're saying at least a 25% productivity loss, which is why some of these positions are needed. And it's causing more phone calls. You know, we're having to do more with folks who aren't getting what they need when they need it. In child daycare, which was the most recent program we brought in, we're having to work reports, overpayment, underpayment reports that are, 30 pages long? And you have to work those on a regular basis to get those correct. I mean, it's having an economic impact on the agency.
That alone would save 25 positions if this was working.
Well, I don't know that it'd go that far.
I mean, you just
but if it was working properly, it would certainly help.
I'm good.
We're sort of behind time a little bit, but the manager has something.
If I could just make 3 brief comments on Jan's presentation. Great presentation, first of all.
Yes,
Both
it was.
DSS
Thank you very
and health.
much.
But just to reiterate her point on page 4, the slide talking about the persistent poverty, both general poverty and child poverty, that drives a lot of the budgetary needs and demands in human services, i.e. health, public health, And the second thing being, of all the positions she asked for, the 24 positions, we only recommended a small handful. I asked staff, let me say on the positions, her positions are the most cost effective because they're cost shared between state, federal, and local dollars. They're normally either 75% federal, 25% county, or sometimes they're 50-50, sometimes they're 66 and 2/3 and
It's all over the
1/3.
place.
Yeah, normally we just say 50-50 on average. But I asked them, I said, if we were to fully fund the remainder of the positions that are not recommended, roughly how much are we talking about? And they're saying a back of the envelope estimate right here would be about $500,000, so a little less than half a penny on the tax rate. But even if we said, hey, that's the best investment based upon the case that's been sold here, even without these positions, we have space needs that are just out the wazoo in terms of what we're trying to address. So if we funded all these positions, we'd even be more behind the 8 ball trying to figure out where to put them. I'm not trying to argue not to consider additional positions, but trying to paint the whole picture. So.
Okay. Thank you, dear.
Right, we are exploring that for our economic services folks. There are probably a small percentage that might be work from home, but that means you've got to have well-trained,
Right.
self-motivated staff, and we've had probably 50 to 75% turnover in that area in the last couple of years just because of the stress level, et cetera. So I don't, but and there's some logistics to work out with, but I think it's more doable today. We tried it with about 3 or 4 positions initially. And what I call the care and feeding got to be more of a problem than what we were getting out of it, but it worked. So I think today we're in a much better situation from the standpoint of all the support that they would need, that it might not be quite so difficult. So that's certainly something we want to look at over the next year to try and start moving some of those positions home. We do occasionally have a temp that we use, a retiree that helps us during the Affordable Care Act, and she does do the bulk of her work from home. She doesn't come in much at all.
Thank you again.
Take my stool and go.
Mr. Schmidt, oh, I'm sorry, Mary, excuse me.
Before Ms. Elliott leave, I want to say, and we've talked about interns and all like this. I want to thank Pitt Community College for providing a class to teach us the NC FAST. So the community is coming out. And then I want to thank ECU and the School of Social Work for supportive means and that sort of thing. But for the most part, I said to our Director of Social Services, because I'm familiar with all the many facets, this community need to get prepared. I asked her, will she roll out a plan to share with the community the fact that social services is a different and new culture, so that we, they won't be panicking. But they need to pay attention to everything about social services from now on, or public health, social service, and all that gamut of human services. Thank you.
In attention to what the state is sending down here for us to do. Welcome. We're looking forward to your presentation.
Thank you. Can I get the book back? I want to be taller. Yeah, I want to. Yeah, that's all right. Thank you. I know you guys have had a lot of presentations. I'll try to keep mine as brief as possible. I'm Andrew Schmidt. I'm the director of our Convention and Visitors Bureau that represents Greenville and Pitt County. And for the new folks that are on the commission, while I'm here, we are a city and county organization. We represent both the city and the county. We market both the city and the county. And even though we're funded through the hotel motel tax, which means we don't get any money from that, the general fund from the county, because the county collects that tax and distributes it to the city, and the city funds it through our office. We want to make sure that this body knows exactly, it's still public money. It's hotel motel tax money. People from out of town pay into that fund, but it's still public money. And because we represent the county, we want to make sure that you know what we're doing and what our funds are being spent on. So just want to take a few minutes and kind of giving you some updates on what we're doing and what we're seeing for the next fiscal year. As a reminder, why we're here is we want to attract people to come and spend their money in Greenville and Pitt County. That's what we're here for. And when they come, our mission is to make sure that they have a positive experience while they're here. If we can do that, we have a staff of 7, which is a smaller staff for a city our size. But if we can get people to post on social media and on their Facebook and take Instagram pictures and talk about their positive experience, all of a sudden our staff of 7 becomes a staff of thousands. So we want to make sure that those experiences are positive, whether they come for a convention or meeting, whether it's a family reunion, whether it's a sporting tournament or leisure travel. We want to make sure that our infrastructure is up to snuff. So here's a little bit about our goals. We will create a marketing plan for 2019-2020 off of these goals. These are goals that were determined through our annual retreat that we do with our staff and our board. So the first goal is to increase convention sales. That will always be there because we have a convention center and several hotels within that campus, and also 20 other hotels that we want to fill up. So bringing conventions and meetings in, statewide conferences like the Association of County Commissioners, which I saw Jason King last week, and I was like, hey, and I thought, well, maybe I ought to ask the county if they want to host it again first, so I stopped. But so you're familiar with those types of conferences that come to Greenville. And we want to accomplish our 2 goals with that. The micro goal is the big goal, and that's to create economic impact. The more people spend money here, the more point of sale tax we get, and that's important. But the macro goal is to expose people to Pitt County, because what's happening in Pitt County is extraordinary right now. We are growing, we are evolving, and so when we can bring 1,000 people that have never been here before for the first time, that is a big thing for us, and that's a marketing tool. So that's one. Second is to grow the number of sports tournaments per year, and also try to increase the number of facilities that we have to use for sports tournaments. That's a big market for us, and we have a tournament here almost every weekend, and if it's not okay, and so we've got a lot of pieces in place, but we want to make sure that cultural and arts opportunities are very, very important. They also help you differentiate yourself from your competition. So you have to remember, for a group like our organization, we're competing against other cities to bring people here. People only have a certain amount of discretionary income that they can spend. And so they can choose on what city they want to go spend that in, what county they want to go spend that in. So places like Asheville and Charlotte, Greensboro, Winston-Salem, Pinehurst, Hickory, Fayetteville,